Hi everyone, welcome back. So today I am going to be talking about something that actually we don't really talk about that much, but while it's something that I think people probably think, oh well, there's nothing I can do about this, actually in some cases there are things you can do. So I'm going to be talking about mainly knee valgus, which is basically knock knees, and a little bit about varus, which is bow legs. Now, dependent, there are numerous causes of these things, and depending on the cause, really depends on, sort of what sort of treatment is available. But certainly, with the valgus in particular, there are, postural issues that certainly can be helped through certainly massage therapy and some other sort of exercises and things. So, so basically, when the bone segment that is distal or kind of furthest away from a joint sits at an outward angle away from the body's midline. This is known as a valgus. So you can see here in a normal knee joint, so you've got the thigh bones that come down, at a bit of an angle, but generally fairly straight, which then means that the lower leg is properly in line with the ankles. Now, in the case of a valgus, as we've just said, the distal end, so the end of the bone that's furthest away from the joint, sits at an outward angle. And what this does is it then means that the knees kind of come inwards. And obviously in a varus, which is the opposite, which I will talk a little bit about, the angle of that distal part of the bone is inwards towards the midline of the body, which creates the knee, means that the knee comes outwards, creating this bow-legged appearance. So that's a varus. So, as we've said, knee valgus is characterised by this inward bending of the knee, and this occurs when structural deformity or any kind of weakness in the muscles and ligaments causes internal rotation of the hip and the femur. So it's coming inwards, which then brings the knees in and means that there's outer rotation of that lower leg, because the shin bone is compensating by externally rotating, and then you end up with pronation of the ankles, so the feet are turning inwards. So while generally seen in children, knee valgus deformities may actually continue into adulthood. About 20% of children under the age of 3 will have greater than an 0.4 of an inch space between their ankles. But usually this would correct itself, and usually we find by sort of 7 years old, this reduces to around 1% of children that have this space. But in rare cases, usually in cases where there's some sort of underlying condition, knee valgus may continue into adolescence or even develop in adulthood. So I'm going to talk about some of the structural deformities, the muscle groups where, we need to look out for weakness, and sort of these related underlying conditions. So first off, we're going to look at causes of knee valgus. So as we've said, there can be some structural deformity, whether that be of the knee or the femur or thigh bone, or the tibia, the shin bone, maybe something like rickets in children as well. Certainly flat feet. We know that flat feet causes sort of overpronation of the foot, so they sort of turn inwards, which obviously then impacts, on the whole alignment of the leg. Possibly traumatic injury, arthritis in the knee, whether that be rheumatoid arthritis or osteoarthritis, muscle imbalances due to, poor posture, and I will go on to talk about those in more detail. Genetics may well play a part, and as we said, poor posture. So I'm going to talk really about posture a little bit now, because as I said at the beginning of this video, there are some types of knee valgus that can be treated and there are some that can't. Now, as we've said, if there's some sort of underlying condition, so for example maybe arthritis, the likelihood is this is not going to get fixed. But if your valgus deformity is due to some sort of postural alignment issue or some sort of muscle weakness, then certainly there are things that can be done to try and correct this. So there are various muscles which stabilize the knee and enable full range of motion in the knee. For example, the quad muscles, the IT band helps to stabilize the knee, and also the calf muscles, the gastrocnemius and the tibialis anterior certainly, will sort of contribute to range of motion in the knee. But for the purpose of this discussion, we're looking at things like the hip abductors, so those muscles that draw the leg away from the midline of the body, external rotators, and also the quads and hamstrings. So dealing, if there's any muscle weakness, dealing with that is vital in ensuring proper knee alignment, which means that the weight is then evenly distributed, through the hips, knees and ankles. With knee valgus, there, as we've said, you end up with external rotation due to weakness at the hip, and internal rotation of the femur due to the hip abductors, and also the pelvic muscles. So the first muscle that we're going to talk about is tight adductors. So these are it's a group of 5 muscles on that inner thigh going up into the groin. Now, if these muscles are too tight, they will pull the thigh inwards and internally rotate the hip, because they're sort of pulling it across. Now combine that then with weak abductors. So here, the abductor muscles, we're talking about the gluteus medius, gluteus minimus, and the TFL, all up around the hip. So when we combine tight adductors, which pull the femur inwards, with weak adductors that pull the leg outwards, this means that there's a greater inward pull from the tightness in the adductors than outward. And that's why the knees then get drawn inwards. Also, if we look at flat feet, they cause poor alignment of the knee through that overpronation. And they're generally present in anyone who has, valgus of the knees. Okay, so on this diagram we can see, obviously, with flat feet, you've got the overpronation, ankles turned inwards, and this causes an inward rotation with the knee turning inwards. But certainly one of the other things that we need to look at with any client coming in is pelvic tilt, because if the person has anterior pelvic tilt, where the pelvis tilts downwards at the front and then up at the back, this can also encourage internal rotation, and obviously lateral pelvic tilt as well will have an impact as well, because everything will be out of alignment. And I will be doing a post on pelvic tilt shortly. So certainly as a therapist, if someone comes in with a valgus, you certainly want to be looking at the pelvic tilt, which, to be honest, if you've got someone coming in for a sports massage, it's one of the first things you should be assessing anyway. But another thing is to think about is sort of the difference between men and women in anything that kind of involves the pelvis, because one of the other sort of factors in knee valgus is anyone with naturally wide hips. Now, obviously, women naturally have wider hips than men, in relation to the rest of their body. And they have a higher, what's known as the Q angle. So it's that angle that the femur kind of sits at the hip, or the angle that it sort of, turns slightly inwards. And certainly it seems that people with naturally wide hips and that increased Q angle do seem to be more likely to develop a knee valgus, and this is because that increased angle at the hip, again, like with the anterior pelvic tilt, will promote internal rotation of that femur, so the thigh bones are sort of pulled inwards. So these are two really important things to assess. Identifying the cause of the knee valgus is essential in finding an effective treatment, but this, can prove to be difficult because obviously the knee sits between the ankles and the hips, so the issue can be with the ankles or the hips or the pelvis. It's not always an easy task, identifying the cause. But if poor posture is recognised as a problem early on, then the valgus more than likely can be corrected. So in terms of symptoms of knee valgus, well, the main one is a knock-kneed appearance. So when standing with your legs together, in someone who's knock-kneed, the ankles will have either 2 inches or greater than 2-inch space between them, and that's because of the outward rotation of those shins. If left untreated, the valgus can progress, and it can cause other complications such as altered gait or walking pattern, possibly limping, which obviously then you're going to get overcompensation of other muscles, reduced range of motion, difficulty possibly maintaining balance, pain, sort of hip, foot, ankle, knee pain. Although pain isn't generally a symptom, but certainly if the valgus remains untreated, it can become an issue. And also low back pain, and certainly if there's some pelvic tilt issues, low back pain you would expect, to sort of coincide with that. And also, if left untreated, there can be either swelling or, inward buckling of the knee. But usually these things would occur, where there's an underlying condition. So also if left untreated, other complications can be, so things like there'll be an increased risk of meniscal tears, for example, with knee valgus. And again, I've done a video on meniscal tears, so if that's an issue for you, do take a look at that one. And certainly, you're risking joint damage, not only to the knees, but also to the ankles and the hips, which can then go on and impact on the muscles and all sorts of other things. And also osteoarthritis can develop really due to, the wear and tear on, on the knee joint. And potentially also, the hip, where there's that internal rotation, it's not in a natural alignment, you're going to get more irritation. So how do we treat knee valgus? So, as I've explained, treatment is more of an option where there are postural issues. Knee valgus caused by structural deformities, cannot be fixed or prevented. So in these cases, treatment will really focus on reducing symptoms, whereas, as we've said, posture-related valgus can be corrected. So we are potentially looking at medication. If there are underlying conditions, medication to treat those conditions, just to try and manage the symptoms. Or potentially pain relief in more sort of serious cases. Surgery is an option. It may involve insertion of a plate to basically correct the knee alignment, or to realign the femur, the thigh bone, to correct the angle at which that sits. So there's 2 options there with surgery. Also, if you are someone that has flat feet, like I always say, arch supports, just to and also insoles as well, potentially. And this is really to counterbalance the sort of change in walking patterns, and also to counterbalance that additional pressure, that is placed on the knees and hips and ankles due to flat feet. But yeah, one of the best treatments really is massage and exercises. And certainly, in postural cases, this will help to strengthen those weak hip external rotators and hip abductors. So where there's sort of weakness in those glutes and the TFL. But also, and this will restore flexibility to the hips, but also it will help to relax, and lengthen those tight adductors that are pulling the femur inwards. So it can work from both angles. In terms of prevention, again, knee valgus due to some sort of structural deformity can't be prevented. But if it's due to a postural issue, then we need to be looking at fixing muscle imbalances through massage or exercise before they become a problem. Maintaining a healthy weight. Obesity does increase the pressure on the joints, particularly on the legs and the knees. Also avoid hyperextending the knees, because this can damage the medial collateral ligament in the knee, which also helps to prevent inward buckling of the knee. And also it can damage the anterior cruciate ligament, ACL, which stabilizes the knee in those rotational movements. Now, obviously, if you're someone who has hypermobility or Ehlers-Danlos, which I've also done a video on, hyperextension of the knee kind of comes with the territory, for a lot of you people. So in those cases, it's not a huge amount, you can do, but yeah, do try not to hyperextend the knee. Also, in terms of maintaining a good sitting posture, this can really help. Sitting with knees bent at a 90-degree angle, feet flat on the floor. Don't sit with your knees together and ankles apart, because that's just going to really encourage bad postural habits. When working out, ensure that you're using good technique, and particularly with things like squats and lunges and any other exercises that can place, additional stress on the knee and have that potential for inward buckling. Now, I am going to talk a little bit about a squat exercise that you can do just a little bit later. But in terms of just while we're talking about these kind of exercises, that place extra strain on the knee, obviously, you can see if you're doing squats with your feet turned outwards, what happens is the knees then kind of, the whole angle, with the hips is kind of a bit skewed. So the knees are much more likely to, pull inwards. And you're not going to be able to get quite as deep in your squat. It's going to be quite a high squat. And this again is because of that internal rotation of the thigh bone, which again is kind of pulling the knee inward, which when you've got stress coming through that knee joint, you're going to get inward buckling. But hopefully once, if you have massage treatment to address the tight muscles and the weak muscles, and if you can work on your squats the way that I'm going to show you, then, you should, even if the feet are pointing outwards slightly, you should still be able to get the knee in line with the feet, because you're not going to have that tightness on these adductor muscles down the inner thigh. They won't be pulling the knee inwards, so you'll be able to maintain that alignment with the feet, which then allows you to come down deeper in the squat. Okay, so I'm just going to talk a bit more specifically about how massage can help with the postural alignment. Certainly it's, you may find it really useful to begin some regular sports massage sessions. Yeah, there are sort of a couple of ways that, this can help. So firstly, in terms of stretching those tight adductor muscles that run down the inner thigh into the groin, tightness here, as we've said, can cause inward buckling of the knees because it's pulling that leg inwards. But through use of myofascial techniques, we can lengthen these muscles and release them, which obviously then stops that internal rotation, of the femur. Now, I know a lot of you out there use foam rollers. This may be an option, to kind of release those adductors. And certainly you can get, there's like a sort of massage roller stick you can get as well, which again could be used. But the adductors are particularly sensitive muscles, so it probably won't be pleasant using those. And massage certainly will be more effective, if you've got someone who's trained to feel those muscles, and they'll be able to really, ensure that the muscle is properly released. Another way that massage will help is by strengthening those weak adductor muscles that pull the leg outwards to the sides. So we're talking about if there's weakness in the glutes and also the TFL muscle. What happens is that if they're weak, it basically just allows those tight adductors on the inner thigh to pull the leg inwards even more. But sports massage can correct this imbalance, not only by relaxing and releasing those tight adductors, but also by strengthening the adductor muscles, which help to rotate that femur back out externally. Also, by seeing a sports therapist, you can be assessed for any kind of pelvic tilt, particularly anterior pelvic tilt, which again promotes that internal rotation of the thigh bone. But by, being offered some corrective exercises and through manipulation of the surrounding muscles, in order to stabilize the pelvis, we can again just correct those rotational problems. Another way is by incorporating trigger point therapy into massage, which I know a lot of sports therapists we do. And this can really just help to ease any pain. You know, obviously if you've gone untreated for a while and the pain is starting to kick in. But also trigger point therapy can help to just restore symmetry to the soft tissues and joints. Okay, so I'm going to talk now about some basic exercises that you can do to really just, again, try to work on relaxing the tight adductor muscles and, you know, to strengthen those abductors, you know, on the outside of the hip area. Okay, so the first exercise to address those tight adductor muscles on the inner thigh, along here, going into the groin, is a basic standing adductor stretch. So you're going to stand with your feet approximately 3 foot apart, shift your weight to one side, you know, allowing that knee to bend and keeping the opposite knee straight. And if your valgus is one-sided, then it's the, you know, it's that valgus side that you want to be straight. So keeping this leg straight, you're gonna just shift your feet apart to whatever is comfortable until you feel you can lean towards this side and feel a stretch down those adductor muscles on the inner thigh there. And you're going to hold for about 20 seconds and then repeat on each side, certainly if your valgus is bilateral. Okay, so the next ones are these side-lying leg raises. So as it says, just lay on your side, support the head, and then you're just going to lift that top leg up away from the body, keeping the toes pointed to really engage these muscles up here, and raise the leg, hold, and then back down gently, and you're going to repeat about 30 times. And this will really help to strengthen these adductors here. So that's the, you know, like the glute minimus, glute medius, and the TFL that sit along here and are responsible for that abduction. The other one you can do are, you know, these side planks with a leg raise. Now, side planks where you, again, raise the top leg, working those abductors rather, that we've just talked about. Now, this can be difficult when your abductors are weak, but if you do struggle with the side plank, you know, this is a good exercise that you can progress onto once you're completely comfortable with the side lying leg raise. Now, we talked about squats a little bit, you know, and how we need to keep the knees in line with the feet in order to be able to do a deeper squat. So what you can do is a banded squat where you use a resistance band just slightly above the knee. And what this means is that as you squat down, you have to basically push the knees against the band to keep the resistance there, which means that you end up having to pull the knees outwards. And what this does is it will work those abductors on the outer hip and encourage also proper technique with your squatting, because you'll be keeping the knee in line with the feet. Okay, so that's knee valgus pretty much covered. So I'm now just going to talk a little bit about knee varus, which is the bow-legged deformity. So this really occurs when the tibia or shin bone turns inwards and basically ends up misaligned with the femur. And this causes the knee to face outwards instead of straight ahead. Now, if the tibiofemoral alignment, so the alignment between the shin bone and the thigh bone, is not 180 degrees, you may find that even after many years have passed, you might just suddenly get symptoms starting to arise. So in terms of causes of varus, certainly, and with it if it occurs in children, vitamin D deficiency can be to blame, which may result in rickets. Newborns certainly, as with valgus, can be common in children, because their bones haven't yet, moved into their permanent position. Children generally outgrow varus knee and will develop a healthy alignment of the knee. In adults, osteoarthritis certainly can cause the leg to bend outwards. And this is really due to degeneration of the cartilage in the knee. But as well as osteoarthritis causing varus, varus knee can also cause osteoarthritis. And this is due to the tibiofemoral alignments being poor, which then obviously increases wear and tear on the joint. Other causes, things like Paget's disease, achondroplasia, bone tumours, infections, brittle bone disease, any form of injury really, sort of around that knee joint. And also Blount's disease, which is basically a growth disorder of the shin bone. So, yeah, quite often with varus, it tends to be more of a sort of underlying condition, as opposed to the valgus, which, quite often can be a postural issue. So in terms of symptoms of knee varus, obviously the bow-legged appearance is the big one. But also in adults, certainly, they can experience pain around the inner knee. Children, quite often, they may be asymptomatic. But if the varus again remains untreated, joint pain certainly can start to kick in. And there may also be cartilage degeneration in the knee, which, as we've said, if untreated, can develop into osteoarthritis, which is going to cause more problems. So in terms of treatment for knee varus, actually, kind of the options are limited. Obviously, if it's a child and it's sort of early stage rickets, certainly taking a vitamin D and calcium supplements, can kind of help prevent that sort of, worsening. Surgery is an option. Osteotomy will basically help to reshape and realign the bones so that tibiofemoral alignment is kind of at the 180 degrees, so that sort of, they're in a sort of straight line and you've not got the shins going, you know, out or inwards. But apart from that, really, the only options are sort of some sort of physical therapy, you know, such as massage, and also weight training. Really with the focus being on strengthening the surrounding muscles. But it's unlikely to obviously, you know, change, you know, sort of any bone deformity. So yeah, it's a bit more limited in terms of treatment, you know, than the knee valgus. So there's not really much more to say on knee varus. So that's really all from me on this subject. But yeah, feel free to comment, contact me through my Facebook or Instagram with any questions, and I will answer you. Yeah, for now, that's really all from me. Feel free to subscribe to my channel because there will be a lot more sort of sports therapy related posts coming out. I realise a lot of mine at the moment are more medical, but I will be doing a lot more sports related posts, and talking about you know, the common injuries that occur in certain muscle groups and things like that. So keep your eye out for those, and I will see you again. Bye.